I think one of the things we've got to remember is simulation is something that's been done by many different industries for many years. And only the British would make a wooden mechanical horse used in World War I. And that's the earliest example. I'm sure there were earlier ones that I could find. But also, for example, NASA and all of the space exploration, they would never do anything without simulation. So here they're testing equipment and the spacesuit underwater to see how safe it is. So, you know, there is simulation going on in every industry, and actually in healthcare we've been doing it for a long time. Typically, simulation for technology and devices, and more recently, simulation for processes. And so we use it to support healthcare improvement, and this is David Beckham here with his oxygen mask on. And this is in a room in my organisation that is usually a room used for meetings. So we just took the chairs and tables out, and we asked our local hospital if we could borrow a bed and some other equipment, and we just shipped those in for the day or 2 days. But equally, we have gone into hospitals and used one of their rooms just to help them be on site and do simulation in their rooms. Now, what I think is really important is when we're thinking about innovation, we know that if we're saying something is innovative, it's not really been tried in the context that we want to try it in before. And that means there's always a risk. And that's why simulation is so important. We want to tease out all the problems that there could be before we get anything near to a patient or near to staff. And I really like this phrase. In theory, there is no difference between theory and practice. In practice, there is. And, you know, we can sit in rooms and theorise about ideas and innovations and think that it's going to be fine when we translate those into practice. But actually, when you do that, there's a big gap between our thinking and what can happen in reality. I think the other really important thing is it allows you to fail early and fail safely. And there's a picture there of, I think that's a doctor, and they wanted to implement handheld monitoring and information devices. But, you know, they weren't sure exactly what they wanted to capture or what the screens wanted to look like. So instead of them bringing the software supplier in early and costing a lot of money per hour, we gave them a post-it notepad and got them to talk through, to simulate what they thought they wanted to happen and to draw it. And so when a number of doctors and nurses and other staff had done this, they finally agreed on what they wanted to happen, what they wanted to capture, and what they wanted each screen to look like. Then they gave that to the software developer, and it cost £1 million less than they had budgeted, because they'd budgeted for a lot of time from the software developer, and it worked really, really well. The other picture, again, is in one of our offices, and we were working with some staff around a little while ago around hand gel for infections, because in England we've had a big problem with hospital-acquired infection. And so again, we were simulating walls and creating hand gel containers with staff to look at where they should be, what they should look like, how they could be made attractive, because in our system we'd got hand gel dispensers all over the place, but people weren't using them. And typically it was because they were the same colour as the wall and they didn't notice them. So, you know, just by using a little bit of cardboard, as Scott mentioned this morning, we could prototype lots of things. The final thing I just want to mention is some work that we did with hospital porters who transport patients around for us. There was a big problem with this. All of the porters in one hospital were about to be sacked because it was thought that they were inefficient and they weren't serving the needs of the hospital. So we went to work with them and helped them to do observation. To really understand what the problem was. We did interviews with nursing staff and other people, so we used the same techniques as we've been talking about with experience-based design and innovation in general. And then we brought them into a prototyping workshop with a number of other people. So we had other hospital teams, and we had some people from outside of health. We had IDEO, who are a design industry. We had Nationwide, who are one of our banks. We had Oracle, who's a software supplier. We had our Royal Mail service. And we had Tesco, which is one of our biggest supermarket chains. Royal Mail and Tesco were particularly important because what they have a lot of experience with is logistics, moving things from one place to another. And that's what porters do. So we thought that would be really good. And Oracle particularly to think about if there was any information technology solution that could help. So we'd done the observation, and that meant that porters were walking around with hard hats and cameras so that we could film everything that they were doing. We brought these people into a simulation event, and we shared with them what had been observed and some stories. And I'm going to tell you one story here. So the big problem about these porters from the staff perspective, particularly nurses, was they said when we needed a patient moved in a wheelchair, the porters took ages to find a wheelchair. And they often couldn't find a wheelchair, so the porters are useless. And it's moving me on. And when we then did some observation, and when we did interviews with the nursing staff, this is what they were saying. And they then said, so do you know what we do? I said, what do you do? We hide the wheelchairs. We said, well, where do you hide the wheelchairs? And so they took us to a locked room that only the nurses have the keys to, and they showed us all these wheelchairs. Every single ward had 1 or 2 wheelchairs hidden. We said, how can the porters find the wheelchairs if you're hiding the wheelchairs? And they hadn't thought of that. So observation gives you very good ideas about what the real problem was. The poor porters couldn't possibly do a good job because the nurses were preventing them from doing it. Anyway, we shared the stories, shared all the observations, got everybody together, and basically they came up with ideas and they did some scenarios just in the space, moving things around, testing things. And what they came up with was 286 different ideas to improve that portering service. The porters then synthesised those ideas and went with 9 to their hospital board. The hospital board said, yes, you can do these 9 ideas, and the hospital board gave them £10,000. They implemented the ideas, and one of the ideas was that every wheelchair has a tracker on it, so that the porters knew at any time where the wheelchairs were. But there were also a number of other ideas implemented. 6 months later, they came back and said, okay, it's all implemented, we're working really well, everybody loved what they were doing, said it was the best portering team ever, and the porters said, okay, one of the members of staff is retiring. We are so efficient, we do not need to replace that post. and they saved £20,000 because they did not replace the post. And that was a decision made by the porters because they knew they could work effectively without that person. And so by implementing those ideas, they've been able to increase efficiency, improve satisfaction of their role, the nurse's role working with them, and save money. So just a little example there. Thank you very much for your time.